Happy New Year to all the dental community in Canada. I wish all the dental sector in Canada a prosperous 2016. Today I will give my view on new dentists coming into Canada. Between 2010 to 2012 and 13, the federal government in Canada has welcomed maybe up to 2,000 dentists into their society. Now I think it's the responsibility of the government or the stakeholders over here to incorporate those dentists into the system. Of course, there is a highly regulated system for the new immigrants as dentists. Examination part 1 is twice a year. Once you pass that examination, you are inducted into a university system which has limited seats. As I'm myself right now also a teaching professor, I know for sure you can always increase instantly in the same facility about 15-20% seats. So this will not solve the problem, but at least this will be a relief for the incoming dentists that we have more seats now. On the other hand, if you are not inducted in a university program, then a dentist has to go for the clinical evaluation. I have observed as dental association, as academician, I have done 2 post-graduations from College of Physicians and Surgeons of Pakistan, and I did my Masters in Restorative Dentistry from Queen's University of Belfast. I feel as compared to other countries, this is very, very expensive. I cannot quote exactly, but there is no system in the world, the clinical exam, where you require about $20,000–$25,000 to really appear in the exam. And so this has to be taken care of, really taken care of. And on the other hand, they should be utilized like managers in the office or the treatment coordinators, and I can assure you that they know their work. Every dentist in the world, they know their work, what they are doing, so they can be very easily incorporated into the system. I visited European dental schools, of course studied in Pakistan, then did post-graduation in England. I have seen quite a few dental schools in America also. Canada has a very good dental system. But on the other hand, rest of the world is also at par. The exam, especially the clinical exam, should not be overcritical. At the end of the day, once you graduate or once you qualify, only the basic criteria is that you have to be safe. So let's not be overcritical. Plus, I think I will really insist and request the authorities that the attempt should not be limited. The examination system should be more frequent. It can be thrice a year also. The continent of Australia or Australia, New Zealand, they are taking the dentists into their system and they are sending them into the area of need. And I'm sure if the government policy is to take the dentists into the system as immigrants, there must be a requirement of dentists in this country. I think the suggestions I gave will be taken positively. These were my independent and neutral opinions looking at the system. And I frequently come to Canada, so that is why I have I had an opportunity to closely look into the system. And as I know like few other systems in the world, so just to help this society, my colleague dentists, not only dentists who are coming from outside Canada, also dental community who is already practicing in Canada, that they all should they should be incorporated into each other in a very friendly manner. Lastly, thank you for all your time, and I wish all the best to all of you. Thank you.